This is Rashmi Gurnani. I am the CEO of AKT Health and your host for today. We are a global company with our offices in India, US, and Japan. And today we bring to you the 4th edition of Global Virtual Healthcare Summit 2023 after 3 extremely successful ones. Today, you will get to hear 12 speakers from the world over. We've tried our best to get together speakers from different walks of life who will be able to guide healthcare professionals as well as students who are interested in pursuing their career further in healthcare. So the first speaker that we have today is Miss Peggy Zorn. Peggy Zorn is from our partner company, Certara. She's the Senior Director of Product Management at Certara. And her session for today is the SEND 2023 updates the non-clinical drug developers need to know. So SEND is a software that is created by Certara, and it is very helpful for companies to adhere to regulatory guidelines. A brief introduction on Peggy. Peggy is the customer success lead for SEND Explorer. She has a strong background in non-clinical data management, warehousing, and the SEND standard, including serving as the lead of the CDISC SEND control terminology team for over 7 years. She continues to be involved in the CDISC SEND team as well as the PhUSE non-clinical working group, which is very popular globally. We've had some PhUSE chapters in India as well. Prior to joining Certara, Peggy worked for 15 years at Pfizer, and 6 of those years were focused on non-clinical data management and warehousing. She has also worked for INDS for several years, which is the company that originally developed the SEND Explorer dataset reviewer and visualization tool, which was later absorbed by Certara. We shall start Peggy's session now.
Hello and welcome to the SEND 2023 Updates Non-Clinical Drug Developers Need to Know webinar. My name is Peggy Zorn and I am Senior Director of Product Management at Certara, focusing primarily on the SEND Explorer dataset review and visualization tool. Just a little more information on me. I have a strong background in non-clinical data management, warehousing, and the SEND standard, including serving as the lead of the CDISC SEND controlled terminology team for 7 years. I continue to be involved in the CDISC SEND team as well as the PhUSE non-clinical working group. Prior to joining Certara, I worked for 15 years at Pfizer, with 6 of those years focused on non-clinical data management and warehousing. I also worked for INDS for several years, which is the company that originally developed the SEND Explorer dataset reviewer and visualization tool. In today's session, we'll be covering updates to the SEND standard for the last year, 2023, and what those changes mean for staff that produce SEND datasets and also the scientists that use SEND formatted data to analyze and interpret study results. These changes include the new version of SEND, version 3.1.1, the introduction of the requirement for SEND for submissions to CBER, expansion of the requirements for the SEND AR version 1.0 for animal rule, the introduction of the requirement for SEND IG version 1.1 for developmental and reproductive toxicology or DART studies, the requirement for the new version of the Defined XML standard version 2.1, and the CDISC publication of the SEND IG DART version 1.2 and SEND IG GeneTox version 1.0. We'll end the section by taking a look at what lies ahead for next year and beyond for SEND, as major additional changes are on the horizon with SEND version 4.0, the next major release for SEND. SEND is a standard for exchange of non-clinical data. It is the CDISC standard based on the SDTM model and covers the study design and individual animal data for in-scope non-clinical studies. Like SDTM datasets, SEND datasets are produced in SAS transport or XBT format. The current versions of the SEND standard in use at FDA now are SEND 3.1, SEND 3.1.1, SEND IG DART version 1.1, and SEND IG AR version 1.0. SEND datasets are required for single dose, repeat dose, carcinogenicity, cardiovascular, and respiratory safety pharmacology, and embryo-fetal development studies with start dates after those published in the FDA Data Standards Catalog. SEND is required by both CDER and CBER. The requirement for CBER took effect on March of this year, and SEND is now required for in-scope studies and data types for studies starting after March 15, 2023. SEND data submission packages include SEND datasets, as well as a defined.xml file and Non-Clinical Study Data Reviewer's Guide, or NSDRG, in PDF format. The best resource for determining the requirements for SEND datasets and associated data standards for FDA is the FDA Data Standards Catalog. This document is an Excel spreadsheet that lists all the submission data standards relevant for FDA. Each data standard version is in a row in the spreadsheet, and columns include details about the data standard, such as exchange or file format, standards development organization responsible for the standard, such as CDISC, ICH, etc., implementation guide name and version, the FDA center or centers the standard applies to, and key dates associated with when support and requirements for the standard begin and end, and any details associated with the requirement dates, such as specific dates related to requirements for NDA versus IND submissions. This file is updated frequently to add new standards and associated dates and details to help industry better understand the requirements, so always make sure you're using the current version. This is a screenshot of the FDA Data Standards Catalog published on October 17th of this year, filtered to include those associated with non-clinical study datasets or XML standards only. You can see here the columns present, including the date columns. Keep in mind there is a difference between the date that support for a standard begins and ends and the date the requirement for a standard begins and ends. FDA support for a standard means that if a sponsor includes data following the standard in a submission, FDA can use it, but doing so is not mandatory. FDA requirement for a standard means that use of the standard is mandatory for the conditions set forth in the catalog, and a link to the statutory, regulatory, or guidance authority sources associated with the requirement is included for reference. Note, for many of the standard versions, the requirement dates are different for NDA versus IND submissions. As of March 15th, there were several standard version requirements enacted that are related to SEND and non-clinical data and submissions. SEND version 311, the latest version of the SEND standard, is required for studies with start dates after March 15th, 2023. In addition, SEND 3.1 or SEND 3.11 datasets are required for submissions to CBER for studies starting after March 15th, 2023. Previously, only CDER submissions required SEND datasets. The SEND Animal Rule version 1.0 also became required for IND submissions for studies starting after March 15th, 2023. The requirement for this standard for studies included in NDA submissions started last year in March. Another big change this year is the beginning of the requirement for SEND for developmental and reproductive toxicology studies, or DART. The DART version 1.1 standard for embryo-fetal development studies is now in effect for studies starting after March 15, 2023 that are included in NDA submissions. The requirement for IND submissions for DART version 1.1 will take effect in March 2024. And finally, the requirement for version 2.1 of the Defined XML standard also took effect on March 15th of this year. Defined XML files are required as part of all SEND data submission packages. Of note, both SEND 3.11 and Defined XML 2.1 are now required for studies starting after March 15, 2023, but because support and requirement end dates have not been published for the prior versions of the SEND or Defined standards in the FDA Data Standards Catalog, either SEND 3.1 or SEND 3.11 or Defined 2.0 or Defined 2.1 are acceptable, although latest required versions of the standard are preferred. As you can see, a lot is changing for SEND and non-clinical submissions in 2023. We'll be going over each of these changes in more detail in this webinar. SEND-IG 3.11 was originally released in March of 2021 and primarily covers changes to the pharmacokinetic concentration and pharmacokinetic parameter domains, or PC and PP domains, to ensure that creation of time concentration curves could be done by FDA using the data from these two domains. To support this, there are changes to variable permissibility, assumptions, and examples, including cross-domain examples, to make it clear what data is expected to be populated in order for the data to be used as intended. Most notably, the PC ELTM and PC TPT ref variables were changed to expected rather than permissible, and the PC DTC variable was changed from expected to permissible. This is consistent with the FDA Technical Conformance Guide statements related to the PC domain and variables used to support creation of time series graphs and automatic calculation of pharmacokinetic parameters from sets of related plasma concentrations. In addition, the unscheduled flag variable was added to the PC domain to support flagging of unscheduled results. As mentioned previously, at this time, both SEND 3.1 and SEND 3.11 are listed as required in the FDA Data Standards Catalog, with no support or requirement end dates for SEND 3.1, so both are acceptable for submission. For the most part, changes outlined in SEND 3.11 can be implemented in SEND 3.1, so it is recommended that if you are continuing to use SEND 3.1, you adopt the changes recommended for the PC and PP domains in SEND 3.11 and the FDA Technical Conformance Guide, so even data submitted in SEND 3.1 format can be used to create the time series graph and calculate the decay parameters. Up until this year, the SEND requirement only applied to submissions to CDER. As of March 15, 2023, the SEND standard also applies to submissions to CBER as well. The study data and data types included for CBER are the same as for CDER, with the exception of the requirement for SEND-IG DART version 1.1 for embryo-fetal development studies, which is not required for CBER. In-scope study types for CBER include single, repeat dose, carcinogenicity, and cardiovascular and respiratory safety pharmacology studies. Data types required are those modeled in Codex version 1.0 for SEND 3.1. FDA has included in the Technical Conformance Guide specifically related to handling immune data for CBER submissions in SEND 3.1 or SEND 3.11, and is not modeled in these versions of the SEND-IG, but will be included in the next version as the immunogenicity specimen assessments or IS domain is planned to be included in SEND 4.0. In the meantime, CBER prefers that immune response data be included in either the LB or in the IS domain as a custom domain for SEND 3.1 or SEND 3.11. Custom domains are supported starting with SEND version 3.1. Alternatively, per the FDA Technical Conformance Guide, it is also acceptable for immune response data to only be submitted as part of the tables included in the study report. When immune response data is included in SEND datasets, this allows the use of SEND analysis and visualization tools for these endpoints. This is an example of immune response data included in both the IS and LB domains in SEND 3.1 and graphed together using the SEND Explorer data analysis and visualization tool. In this screenshot, both endpoints are graphed over time with separate plots for males and females. Dosing days are also depicted with black triangles along the x-axes. This is a screenshot showing anti-drug antibody data formatted in SEND in a custom IS domain using modeling from the PhUSE ADA white paper, which provides recommendations on modeling of anti-drug antibody data for both SEND 3.0 and SEND 3.1. This is an excellent resource to use when reviewing options for providing immune response data in SEND format. This visualization contains summary data by sponsor group code, sex, and dose, pivoted by time point, with an interactive thumbnail visualization for each time point that shows individual data plotted, as well as the group mean value as the black dash. Subject data across each graph can be highlighted and the thumbnails can be enlarged for easier viewing and copying into presentations or other documents. The implementation guide for Animal Rule version 1.0 became a requirement last year for studies starting after March 15, 2022, included in NDA submissions. As of March 15, 2023, the requirement is now extended to IND submissions as well. Studies submitted under the Animal Rule are different from general toxicology studies in that the Animal Rule applies to using adequate and well-controlled studies in animal models rather than in humans for situations where conducting clinical trials in humans is not ethical. These conditions are generally life-threatening and related to exposure to lethal or permanently disabling toxic, chemical, biological, radiological, or nuclear substances. While typical toxicology studies submitted as part of NDA or IND applications focus on testing toxic effects of treatments, Animal Rule studies focus on natural history of diseases and testing of animal models as well as efficacy of treatments in animal models. The IG for Animal Rule version 1.0 introduces several new domains and variables to the SEND model, as well as updates for SEND-controlled terminology. Also added in March of 2023 is the requirement for SEND datasets for embryo-fetal development studies started after March 15, 2023, submitted in NDA applications to CDER. The requirement for INDs will take effect next March. Embryo-fetal development studies are modeled in the SEND Implementation Guide for Developmental and Reproductive Toxicology, or DART version 1.1. This IG contains new domains for pregnancy and fetal findings, new timing variables to track results relative to gestation start, and significant additions to SEND controlled terminology requirements. FDA technical rejection criteria is not currently implemented for eCTD Module 4.2.3.5.2, which is where embryo-fetal development studies are located in submissions. So simplified ts.xpt domains do not need to be submitted to indicate SEND datasets are not required for a study. If you do submit a simplified ts.xpt domain in this eCTD module, FDA has confirmed that it will not interfere or prevent electronic receipt or validation of the submission. FDA has also provided clarification on requirements for SEND-IG DART version 1.1 in the latest technical conformance guide. The clarifications are helpful in determining specific SEND requirements for common development scenarios. Of note, if a preliminary embryo-fetal development study is being used to assess clinical safety in lieu of a definitive study, then SEND is required. However, studies that are conducted in pregnant or non-pregnant animals only to establish dose or dose schedules for an EFD study, for example, dose range finding, tolerability, a pilot study, those are not designed to inform clinical safety and therefore do not require SEND. In addition, for combination studies such as fertility and early embryonic development or FEED studies and EFD studies, or pre and postnatal and EFD studies, only the EFD-related endpoints collected from animals assigned to the EFD portion of the study that are modeled in SEND-IG DART version 1.1 require SEND datasets. Dedicated juvenile animal studies that typically include multiple phases are not currently modeled in SEND, so also would not require SEND datasets. Now that we will have EFD study data in SEND, this gives us the opportunity to use SEND analysis and visualization tools to look at the data. The screenshot above is what a summary visualization for SEND Explorer looks like for the pregnancy results domain from an embryo-fetal development study modeled in SEND-IG DART version 1.1. From the dataset, mean values for each test can be calculated and a thumbnail visualization produced to show the trend by dose group for each test. This is another screenshot of a summary visualization in SEND Explorer for fetal findings modeled using SEND-IG DART version 1.1. Again, summary statistics are calculated for each dose group for abnormal finding category and a thumbnail visualization generated to show the trend by dose group. Define XML version 2.1 is now an FDA requirement for studies starting after March 15, 2023. This new version of Define XML is similar to version 2.0 with notable changes listed on this slide. In Define 2.1, more than one data standard can be referenced using the new DEF standards element. This means for SEND studies where you may be using SEND version 3.1 for most domains, but STTM for a custom domain, both standards can be referenced. Another new concept introduced in Define XML version 2.1 is subclass, allowing programmers to provide a more descriptive classification of their datasets. As of today, the only defined use case for this concept exists for ATOM submissions. Another change that came with Define XML version 2.1 has to do with identifying empty datasets and variables with no values. This is flagged with a new attribute called def has no data on both the item group def element for datasets and the item ref element for variables. This optional attribute is only needed when the condition is met, i.e. the object contains no data, and will therefore have a value of yes. In addition, whenever a dataset or variable is flagged as being empty, a comment becomes conditionally required to explain why no data is present. When this flag is set, the Define XML style sheet will show no data next to the dataset or variable to indicate that it is empty. Origins were also enhanced to include both type and source, although for SEND datasets, only origin type is used. A full list of changes in Define version 2.1 is included in the Define 2.1 specification available from the CDISC website. As you move to use of Define 2.1 for your submissions, ensure the validator tool you're using has support for this standard. Pinnacle Community and Enterprise versions do include support for Define version 2.1. It is acceptable to submit Define version 2.0 or version 2.1 in submissions until support and requirement end dates are published in the FDA Data Standard Catalog for Define 2.1, although the latest required versions of the standards are preferred. This is a screenshot of what the Define 2.1 file looks like using the updated style sheet for a SEND dataset package where both the SEND-IG and SEND-CT versions have been specified. Notice the table listing the two standards at the top of the page, directly below the study number and title. In addition, the standard used for each dataset is included in the dataset table. This screenshot shows the style sheet representation of the no data tagging for variables included in the dataset that don't contain any data. The unscheduled flag for the DS domain is not populated as there were no unscheduled deaths in this study and includes the no data comment below the variable name. In addition to all the FDA data standards requirement changes for SEND in 2023, CDISC also published 2 new SEND implementation guide versions in June of this year, SEND-IG DART version 1.2 and SEND-IG GeneTox version 1.0. SEND-IG version 1.2 includes modeling and examples for general toxicology studies conducted on juvenile animals, including the addition of the developmental milestones or DP domain and clarification on definition for timing variables relative to postnatal day. This IG also includes updated modeling and examples for EFD studies based on feedback received in the Fit-for-Use pilot with FDA. This version of the DART IG is not yet listed as accepted or required in the FDA Data Standards Catalog. However, it is likely to be added at some point in the future, so watch the FDA Data Standards Catalog for updates. The CDISC SEND team is considering conducting a Fit-for-Use pilot with FDA and interested sponsors sometime in the coming months. The SEND implementation guide for genetic toxicology studies was also published by CDISC at the end of June of this year. This implementation guide is based on STM version 1.5 and aligns with SEND implementation guide version 3.1.1. Current studies modeled in this IG are the in vivo comet, and micronucleus assays. There is only one new domain introduced in this implementation guide, the genetic toxicology in vivo or GV domain, which is modeled to align with the current laboratory test results or LB domain, so it is expected to be an easy implementation. Like the SEND-IG DART version 1.2, the GeneTox IG is not yet listed as accepted or required in the FDA Data Standards Catalog, but may be added at some point. So again, watch the FDA Data Standards Catalog for updates. The CDISC SEND team is considering conducting a Fit-for-Use pilot with FDA and interested sponsors sometime in the coming months. In addition, this IG is expected to be incorporated as part of SEND version 4.0 when that version is finalized. When we look ahead for SEND, the first change that will occur is the requirement for SEND-IG DART version 1.2 for embryo-fetal development studies with start dates after March 15, 2024, submitted investigational new drug submissions or INDs. However, the biggest change coming for SEND is related to finalization and implementation of the next major version of SEND, version 4.0. This version is still in development with CDISC, but is currently projected to reach the public review stage in the third quarter of 2024. This version of SEND has significant changes, including the addition of 8 new domains covering in vivo genetic toxicology with the incorporation of the SEND-IG GeneTox version 1.0, self-phenotyping, immunogenicity, ophthalmology examinations, pharmacokinetic inputs, nervous system test results, skin test results, and scoring scales. Additional changes planned to the existing standard include update of the microscopic findings domain to include targeted staining, sexual maturity and reproductive cycle results, new variables for result modifiers, category, subcategory, and time to detection, as well as depreciation of the tumor findings or TF domain. At this point, CDISC's final publication date for SEND 4.0 is planned for April 2025, although this could certainly change based on feedback from the public review comments and other factors. For more information regarding SEND 4.0 or to get involved in development and finalization of this standard, visit the CDISC SEND website listed in the resources slide of this presentation. This is a list of helpful FDA, CDISC, and PhUSE SEND dataset and Define XML resources to help with all the changes to SEND standards that have occurred so far in 2023. Be sure to keep up to date with any changes to the FDA Data Standards Catalog and the Technical Conformance Guides, as new and updated requirements and recommendations will be included in these documents. My contact information is above, and please feel free to reach out to me if you have any further questions or want to learn more about the SEND standard and tools for analyzing, visualizing, and validating SEND datasets.
Thank you so much, Peggy, for the wonderful insights on the product. I'm sure that the attendees who are listening to you right now would have gained immense amount of knowledge on the SEND software. So we now start the Q&A session for the audience. The audience, you're welcome to put in your questions in the chat box for Peggy on the particular webinar. We give you about 10 to 15 seconds, and Peggy then will take it from there. Okay, so the first question that we have from the audience is, for the studies submitted to CBER, are ADA and other immune response data required to be included?
FDA has said in the technical conformance guide that they would prefer that sponsors submit immunogenicity and ADA data in either the LB or the IS domain. If it is submitted in the IS domain, that would be a custom domain for SEND 3 or SEND 311, and that is supported in those versions of the standards, so it is possible to do that. FDA has also said in the technical conformance guide that it's acceptable to just include the immunogenicity and ADA data as part of the study report tables and not in the data sets. So that is also an option.
Okay, great. So Peggy, there are a lot of toxicology studies that are done globally, especially a lot of them by a lot of CROs in India. So the next question from the audience is on the reproductive toxicology study. The question is, do you know when FDA plans to make a SEND for other reproductive toxicology study types required?
Well, the next version, and the next thing that has the most impact on the DART standards in general is the publication and eventual requirement by FDA of the DART IG version 1.2. But this IG really only introduces the requirement for the general toxicology studies that are done in juvenile animals and the introduction of the DP domain. There isn't anything, no additional repro study types are included in that particular IG. And remember, that IG is still not yet accepted or required by the FDA. The CDISC DART team is continuing to work on development of the standard to cover other repro study types. But at this point, those study types are still in development. They're not ready for proof of concept data sets or certainly not for publication. So it's still a little ways off.
Okay, that's very interesting. The next question that we have is, when is SEND 4.0 expected to be required by the FDA?
Well, as we discussed in the webinar, SEND 4.0 at this point is expected to be out for public review in the third quarter of 2024, next year, and they are hoping to be able to publish it through CDISC in April of 2025, if all goes well. But of course, there could be delays in that based on the amount and content of the public review content and comments and other factors. So if all goes well and it is actually published by CDISC in April of 2025, from that point, then the FDA would need to publish their ability to accept and then eventually require the standard in the data standards catalog. That would probably be at least another year or two before that would happen. So it still isn't really possible to predict it, but certainly not before 2026.
Okay, those are the questions we have as of now, Peggy. Any more questions by the audience, we will email them to you, and the audience will get back the responses to you from Peggy very soon. Thank you so much, Peggy, for taking the time, for giving us such wonderful insights. And we're very grateful for you to be a part of the Global Virtual Healthcare Summit 2023, and I hope you enjoyed being a part of it as well.
Yes, thank you.
Thank you. Thank you so much.